He went to sleep just like any other night. No pain, no warning, no struggle. And by morning, he was gone. This is something I've seen more than once in my medical career, and every single time the family says the same thing. Doctor, he was fine. Completely fine. But the truth is, he wasn't. There was one common habit, something many seniors do every single day, that silently increases the risk of heart attack and stroke during sleep. And today, I need to talk to you about it because this is preventable. If you or someone you love is over 50, this video could literally save a life. We're going to talk about a few common habits that seem harmless, even normal, but can quietly put dangerous stress on your heart and brain, especially at night. And the scary part is, most people don't even realize they're at risk. I'll break this down in a very simple way. No complicated medical terms, just real talk, real examples, and practical steps you can actually follow. Let's go step by step. 1. Sleeping immediately after a heavy dinner. What it is? Eating a large, heavy meal late at night and going straight to bed. Why it's a problem? When you eat a heavy meal, your body has to work hard to digest it. Blood flow shifts toward your stomach, your heart works more, and your blood pressure can fluctuate. Now combine that with lying flat in bed. It puts extra strain on your cardiovascular system. Real life example, I had a patient, 68 years old, loved late night dinners, big portions, oily food, then straight to bed in front of the TV. One night, he never woke up. Hidden risk. Many people think, I'll just sleep it off. But digestion during sleep can actually trigger acid reflux, irregular heartbeat, and even increase the chance of clot formation in some people. Practical advice. Give your body at least 2 to 3 hours between dinner and sleep. Keep dinner light, less oil, smaller portions, easy to digest foods. Your heart will thank you, quietly. 2. Ignoring nighttime blood pressure spikes. What it is? Blood pressure doesn't stay the same all day. For many seniors, it rises at night, even if daytime readings look normal. Why it's a problem? High blood pressure during sleep is one of the biggest silent triggers of strokes. And the worst part? You don't feel it. Real life example, a woman in her early 70s, perfectly active, normal BP during clinic visits, but she started waking up with mild headaches. Ignored it. One night, she had a stroke in her sleep. Hidden misconception. If my daytime BP is normal, I'm safe. Nighttime hypertension is real and dangerous. Practical advice, if you're over 55, consider monitoring BP at different times, especially evening. Take medications exactly as prescribed. Don't skip or adjust timing on your own. And if you wake up with headaches, dizziness, or palpitations, don't ignore it. 3. Sleeping in the wrong position. What it is, sleeping flat on your back, especially if you snore heavily or have breathing issues. Why it's a problem? This can worsen sleep apnea, a condition where breathing stops and starts during sleep. Each pause in breathing drops oxygen levels and puts sudden stress on the heart. That's a direct trigger for heart attacks and strokes. Real life example. A retired teacher, loud snorer, family joked about it. But what they didn't know? He would stop breathing multiple times during the night. He suffered a heart attack during sleep. Hidden risk, snoring is often ignored as normal. It's not always harmless. Practical advice. If you snore loudly, feel tired during the day, or wake up gasping, get evaluated. Try sleeping on your side instead of your back. Sometimes a simple position change can reduce risk significantly. 4. Dehydration before bed. What it is? Not drinking enough water during the day and going to bed slightly dehydrated. Why it's a problem? When your body lacks fluids, your blood becomes thicker. Thicker blood flows slower and increases the risk of clot formation. Clots are what cause many heart attacks and strokes. Real life example, an elderly man avoided drinking water in the evening to prevent nighttime urination. Unfortunately, this led to dehydration. He suffered a stroke early in the morning. Hidden misconception, less water means better sleep, but too little water can silently harm you. Practical advice, stay well hydrated throughout the day. You don't need to drink excessive water right before bed, but don't restrict yourself completely either. Balance is key. 5. Taking certain medications at the wrong time. What it is? Taking heart, BP, or diabetes medications at inconsistent times, or skipping doses. Why it's a problem? Your body runs on a rhythm. Medication timing matters more than most people think. Irregular timing can lead to sudden drops or spikes in blood pressure or sugar levels during sleep. Real life example, a patient used to take BP meds whenever he remembered. Some days morning, some days night, some days not at all. That inconsistency led to unstable blood pressure and eventually a stroke. Hidden risk. I feel fine, So missing one dose won't matter. It does matter, especially over time. Practical advice. Take medications at the same time every day. Set alarms if needed. Never adjust or stop meds without consulting your doctor. Let's pause for a moment. Most people who die in their sleep from heart attack or stroke don't see it coming. Not because there were no signs, but because the signs were subtle, silent, and ignored. Late heavy meals, uncontrolled nighttime blood pressure, poor sleep position, dehydration, irregular medications, these are small habits, but they have big consequences. And the good news? Every single one of these can be corrected. If you're watching this, take it seriously, not with fear, but with awareness. Your body gives you signals. You just have to listen. And if you have elderly parents or loved ones, please share this with them. Sometimes, one small change, one small habit, can be the difference between waking up tomorrow or not. Take care of your heart. It's working for you every second, even while you sleep. And I'll see you in the next video.